Breaking news tonight at 6. Woman commits suicide by holding her breath. Wrong. That's not right. Hi, I'm Noi, and today I'm going to explain to you the respiratory rate feedback system. Breathing is a negative feedback loop. It is a natural reflex, and although we have some control over our breathing, we don't have to concentrate on it. Our diaphragm and our external intercostal muscles expand and contract, causing negative pressure within our lungs, which forces air into our nasal cavity through our pharynx, larynx, and down our trachea and into our lungs, known as inspiration, breathing in, or inhaling. Our lungs have many branches, very similar to branches on a tree. The air is then forced into the bronchi, bronchioles, and then alveoli, the functional units of the respiratory system. This is where the action takes place. The alveoli fills with oxygen, and nearby capillaries will exchange carbon dioxide for oxygen from the alveoli through a process called simple diffusion. This exchange happens because the difference in concentration gradient between the alveoli and the capillaries. Carbon dioxide-rich blood diffuses out of the capillaries and into the alveoli, while oxygen within the alveoli diffuses out into our blood through simple diffusion. As we breathe out, our diaphragm relaxes and the volume in our lungs decreases, which forces the carbon dioxide from the alveoli in the lungs up the trachea and out of our bodies, also known as expiration, exhaling, or breathing out. The oxygen from the alveoli is transferred to all of the tissues through our body by our red blood cells. It is important to know that they are transferred throughout our body by the hemoglobin molecule. This is the cycle of how we oxygenate our body. And this natural reflex is controlled by the medulla oblongata. And we can only control this reflex to a certain extent. Therefore, we cannot override this natural reflex to commit suicide. Try holding your breath right now. How long can you hold it before your body forces you to take a breath? Our medulla oblongata is the control center of our breathing. And within our medulla, there are two respiratory centers, called the ventral respiratory group and the dorsal respiratory group. They make up the medullary rhythmicity area. Our tissues in muscles and oxygen and organs need oxygen to function. And as you sit here and watch this video, you're breathing at a normal rate of 18 to 20 breaths per minute. However, the more you use your muscles, the more oxygen your body needs. So if you got up and did some exercising, you will use more oxygen. Your body will need more oxygen in your muscles. So if you were so because your body is using more using more oxygen, you're also going to have more carbon dioxide output. Ever wonder why we get hiccups? Well, I'm sure you've had a muscle spasm sometime in your life, right? Well, when you hiccup, your diaphragm is spasming. You can also get this if you eat too quickly. If someone doesn't get enough oxygen in the body tissues, they become oxygen deprived. The longer the tissues are deprived from oxygen, the more damage occurs. This, as you know, can cause death. So how does our body know we need more oxygen? Well, we have chemoreceptors in our medulla oblongata, and these receptors monitor the carbon dioxide levels in our blood. Although the medulla oblongata has most of the responsibility to monitor the carbon dioxide, we also have chemoreceptors in the aorta and the carotid arteries as well, which help monitor the oxygen pressures. When receptors detect high levels of carbon dioxide, they send out nerve impulses to the diaphragm and the external intercostal muscles to contract at a faster rate, or to work harder, forcing you to breathe faster, which will increase oxygen in your body. However, once you stop exercising, your breathing will also slow down because your muscles do not need that extra oxygen. And the carbon dioxide in your blood will also decrease. If these receptors detect a low oxygen concentration, then they will signal the medulla oblongata to send nerve impulses to also increase oxygen levels as well. You ever wonder why we yawn? Well, this happens because we have a lack of oxygen in your body. Therefore, a signal is sent to your diaphragm to take a nice, long, deep breath, also known as a yawn. Interesting, no? I just wanted to thank you all for watching my presentation, and I hope this helps you with your exam and studying for the exam. And I wanted to show you my works cited page. There's 3 pages because I use a lot of pictures. But the most important one is this one here in red. That's going to be the one that I grabbed from my Visual Anatomy and Physiology book that I'm using this semester. And this is my last page here of works cited. Thank you guys all, and good luck on your exam.